What's up, guys? So, I'll be talking about the title, The Fix to All Your Problems, right? I've had some athletes tell me or ask me, I've had some patients in the clinic kind of ask me as well, and they're like, why not just, we're doing this, this, and this, why not just tell me how to fix it? Or, you say this, this, and this, why not just tell me how to fix it? And I kind of laugh. Just because it's like there's probably not one fix to your problem. There's honestly so many factors that go into an injury, or why your elbow is sensitive. Don't even get started on low back pain, just because it's so multidimensional and so complicated. If someone tells you that there's one thing to do to fix this, it's probably not true. The classic example was I was talking about shoulder pain during squats and trying to settle those down a little bit. So why not just tell us how to fix it? We can give you tools on how to mitigate situations or painful moments, but in the long term, there's not one thing that's going to make a difference. Yes, we can get better sleep, 100%. That helps with recovery in all manners. Yes, we can get better nutrition. Yes, we can do all the other psychosocial factors. But people are always looking for that one move. Why not just tell me what I need to do? Do I need to do more pulls? Do I need to do more shoulder internal rotation, external rotation? Yes, that stuff can help. But ultimately, when it comes down to, oh, what up, Mark? But ultimately what it comes down to is let's modify what we can. And some people naturally do it and they don't realize it, which kind of irritates me, just because they're like, well, I added these shoulder external rotations and it was fine. It's like, well, you also took a week off of benching and then you slowly got back into it. That is a form of load management. And I'm not saying load management is the fix to all, because then we also have the psychosocial factors, and some people might argue that those are together in the same, which I don't necessarily. I think they are very similar, but it comes from two different trees. But long story short, I just wanted to talk about why the fix to all your problems, as the title, at least it's up here. I have no idea what these look like in other videos, but that's where my title is. The fix to all your problems usually isn't one thing, it's not two things, it's probably going to be a few things. And it's probably not necessarily a quote-unquote fix. It's a guide back to what we were doing, what we need to do in a more functional or less pain-free way. What up, Ross? So long story short, yes, we can give you some things that might decrease your pain sensitivity in the moment, but that's not going to be the long-term solution. Oh, Joe on the vibe here. But wow, everybody's piling in now. My whole point of this, or getting on the live, was just because I can't keep saying that this is going to help fix it. There's going to be multiple areas, I can't even explain how many areas that we pull things through. So back to the shoulder example, it's like, yes, I can't get my shoulder set. We could do a stretch to get some decreased neuro input to allow some more external rotation to get pulled back. But in the long term, it's okay, maybe this is a load management issue or volume management issue that we need to kind of factor in, or just a general warm-up. Yes, we can loosen up the shoulders some. What can we do to loosen up the shoulders? So on and so forth. It's not necessarily going to be that one fix, that one move, that one food, that one extra hour of sleep. It's not necessarily going to be what takes that straw off the camel's back that's going to break it. So, is there a fix? There's lots of fixes, if you want to put it as a fix. But it's most likely going to come from a ton of different areas, and people are doing more things than they realize when they're going through pain and injury. And all it takes is just, even placebo has a effect. If you think it's going to help, it will. If you don't think it's going to help, most likely it won't. Sometimes people do get surprised, but yeah, so when someone says there's the fix to this or the fix to that, and it's like one thing, maybe be skeptical. But yeah, that's all. Just want to hop on the live for that.